Tony Blakely is an epidemiologist and public health specialist from the University of Melbourne, and he joins me now live. Good evening. Is this the peak of cases in Victoria, do you think?
Well, we hope so, but we can't guarantee it. They've just been steadily going up for about a week or so now. I like to think of it as what we've got is we've had three epidemics in succession. The first one was in the 12 postcodes that got locked down. The next one was in the rest of Melbourne that got locked down. And then the third one is amongst the essential workers or the people still out in the workplace. And you can't actually see them separately. So it's like we're on the top of a tabletop mountain and it's taking a while to get off it, to be honest. But the problem we see at the moment is that transmission amongst people out and about because they're Uber drivers or they're construction workers, and then add on to that what you just heard then, that people are not self-isolating when they're symptomatic or waiting for their test result, which is hugely problematic.
So, Tony, what is it going to take to get on top of this? Does the state actually need to move to a shutdown more similar to what New Zealand did?
All right, so what I've been saying over here for a week or so and getting traction is that you only do a hard lockdown for two reasons. The first one is to go for elimination, which myself and others have been advocating for strongly, but is not the current official position. So that doesn't appear to be what we would do. The other reason to go for a hard lockdown is if our health services are under threat, that is the ICU capacity is going to get gobbled up. We're well short of that. There's probably about 2,500 cases per day before you'd be starting to get worried about that. So we're not going for a hard lockdown. It will probably be a smarter lockdown. So we're at about the equivalent of what New Zealand called level 3. We're shifting a bit towards what New Zealand did as level 4, but the extra things that we've got left is really shutting down the essential workers and also shutting down things like department stores. So Kiwis may be surprised to know that we've still got shoe shops open, Bunnings, all that sort of thing. The reason they're not closed is because we're trying to protect the economy at the same time, which is a devil of a situation.
So why aren't people taking this seriously enough as well? Because as we heard there, the Premier saying that a bunch of people are out wandering around with symptoms of sickness, if not COVID, still symptoms of sickness, waiting for a test result. Why aren't people taking this seriously enough?
I've got the same question. I can't answer it. But what I can tell you is that if you go outside at the moment, there's much more traffic than what there was in our first stage 3 lockdown. So we're in stage 3 lockdown again. There is certainly complacency out there. There are certainly more people who are considering themselves essential workers and moving around out there. As far as the people not being tested when they're symptomatic, I just can't explain that. Premier Andrews has been sort of lecturing us as though we're bad students over here of late. I've had some sympathy with him. It really does need to change. But we do have an extra trick up our sleeve, which is, as of tomorrow, mask wearing when you're out of the home, particularly in the supermarket or places you really do have to go inside, will be mandatory. And that should be quite effective at turning things around, particularly if our essential workers, including those who should be at home, unfortunately, wear that mask. So when they go to the construction site, they just don't take the mask off when they get inside the gate, but they leave it on. That should really help turn things around, I hope.
So that's for 12 years old and above, I think it is, isn't it?
Correct. Yes.
But is there any penalty other than a telling off if you don't wear the mask?
There's a $200 spot fine. So it'll be interesting to see how that's rolled out. So, for example, I've just been for a bike ride and I didn't wear my mask. There will be some leniency around that. The key thing, though, if you think about it from a public health perspective, is wearing those masks when you're in an indoor environment, because outdoor spread's not that common. An indoor environment like a supermarket where you really are likely to be within 1.5 metres or even a little bit more than that contact. So that's what I hope people will be out doing enforcement. I'm also suspecting, I can't prove it, I'm suspecting that within a week from tomorrow, if you go to a supermarket in Melbourne without wearing a mask, you'll have people looking at you sideways. I think we'll go through quite a quick cultural change where there'll be a high expectation. At least that's my hope.
Do you fear that the state has lost the battle with this?
Yes. I must confess today I have been thinking, oh dear, because I've obviously been advocating for elimination. If we've got the virus here bedded into the community, that would suggest we've lost the race. However, on the other hand, South Korea got up to 800, I think it was, cases per day, managed to push it down really, really low again. We're at 500, nearly 500 cases a day. The UK has really brought it back around after a bit of a false start, and some of my colleagues are actually ex-Kiwis over there. Public health people are now trying to advocate for an elimination strategy in the UK. So it might take longer to turn it around, but yes, I am concerned about the complacency and the potential embedding of this virus in our community at this point.
Appreciate your time this evening. That is Professor Tony Blakely, who's an epidemiologist in Melbourne there, talking about the fact, well, they've had a record number of cases today, more than 480.